Hold on, do you have aortic stenosis? You definitely need help on choosing Tavr versus surgery for aortic stenosis? This video is just the right spot to know. Transcatheter Aortic Valve Replacement or Tavr is a procedure where a new valve is placed in your heart through a small tube, typically in the leg, whereas, in open heart surgery, a new valve is placed in your heart by opening your chest and replacing your old valve. Tavr is an option for both patients who are and are not candidates for open heart surgery. It is similar to placing a stent in an artery. In this procedure, your cardiologist will place a collapsible replacement valve to the valve site through a catheter. Once the new valve is expanded, it pushes your old valve, where the tissue in the replacement valve controls blood flow. Talking about the benefits of Tavr. It has a lower risk of stroke, major bleeding, or atrial fibrillation. You will have a shorter hospital stay. It definitely involves less pain. And you can rapidly return to normal activities. However, Tavr results in higher rates of vascular complications, paravalvular regurgitation, and the need for pacemaker implantation. Take some time to consider what you have learned about treatments for aortic stenosis. Talk to your clinician about any concerns about valve replacement methods, how long your valve might last, and what options you have.